What do you do when your 18-month-old or 2-year-old says nothing? No mama, no up. And they also are not pointing, not really babbling, and not really making any word approximations that look like they're heading towards real words. It can feel confusing, overwhelming, and honestly a little scary. But today I'm going to make it easier. In this episode, we're breaking down 5 simple science-backed steps you can take right now if your toddler or a toddler you know isn't talking yet. These are the exact 5 steps I wish I had known decades ago when my firstborn son Lucas started showing signs of speech delay and then of autism. And these steps can make a huge difference whether your child is simply delayed or showing early signs of autism or maybe early signs of ADHD or just needs some strategies to nudge them in the right direction. So let's jump into the 5 steps to take when your toddler isn't talking yet. Okay, let's hop right into the subject. So, as you may or may not know, children about the age of 1 should start to develop some expressive language. So, saying mama to their actual mom, or dada, or baba for bottle. These aren't necessarily whole, real words, but they definitely should be beginning to start to use some functional communication skills. So that should start to happen around 1, definitely by 15 months. And we're talking today specifically about 18-month-olds. And by 18 months, they should be adding a few other words in addition to mama, dada, baba, those sorts of things. So what do you do if your child, clients, or neighbors are not developing, spoken language? What do you do? So my most popular video blog by far, hands down, is it speech delay or autism? And you can look for that. Down below, we'll link that. You can watch that video blog, but basically there are some ways to tell, but in the end, it doesn't matter because all the strategies that I'm going to present today should work regardless if a child has an autism diagnosis, if they're just speech delayed, or even if they're typically developing, maybe they're preemies and just behind because of that. So as a parent of a son with autism who's now in his late 20s, he was a toddler with a speech delay. But his language was different. I didn't recognize it. And he went on to get diagnosed with moderate to severe autism one day before he turned 3. I really believe through my progress over the last 25 years, becoming a board certified behavior analyst, online course creator, podcaster, best-selling author, I truly believe that if I had the information I have now, his trajectory and Lucas's life would be much different. So I am really on a mission to get this information out there to help parents and early intervention professionals start turning things around, patching up language as much as possible, teaching kids to imitate, teaching kids self-care skills, reducing problem behaviors. So that's not a big factor in, the situation, which often is. So we're going to cover 5 things you can do today, regardless if the toddler is your own or if the toddler is just a toddler you're concerned about. So the first thing you can do is don't panic or stick your head in the sand or overinflate your child's abilities. So I did all 3. I actually didn't really panic. What I did was I said to my husband when he first mentioned the possibility of autism when Lucas was 21 months of age, I told him he didn't have autism and I never, ever wanted to hear the word autism again. And then I went into a very deep denial. So I stuck my head in the sand. And the other big mistake that I made was I overinflated his language. See, back then in the late 1990s, Lucas always had some words. He started subtly losing some words, or we didn't hear them for months on end. And so when the doctor said he should have 25 words, I was really stretching the situation. I was counting E-I-E-I-O as 5 words. I was counting this little script Lucas used to say, which was delayed echolalia, which I had no idea what that was, but he used to say, please do not feed the ducks quack, quack. And even though quack, quack was on the end, and it's the same word, I still counted that as 8 new words. So that's what I mean by overinflating your child's ability. So you want to really, don't panic, don't stick your head in the sand. The next 4 action steps are going to lead you not to determine if your child has autism, just to determine if they are delayed, how far they are delayed, and to look at other things besides expressive language to help you help your child. Okay, so we covered action step number 1. Action step number 2. You want to check what a typically developing child should do milestone-wise. So the CDC, the Centers for Disease Control, has an Act Early website. They didn't have this website back when Lucas started showing signs, but now they do, and it's a great reference. They have milestones at 4 months old, 6 months old, definitely 1 year, 15 months, 18 months, 2 years, 3 years, 4 years. So I looked, specifically, we're going to be talking about 18-month-olds now. So I looked just a little while ago, and there's on the left-hand bottom corner of the 18-month, there is a printable download from the CDC. We will also put this in the show notes. You'll be able to get the show notes, anything I talk about, marybarbera.com/238. So a typically developing 18-month-old, really important that you look at pointing with their index finger. Lack of pointing with your index finger by 18 months of age is definitely a concern. We want them to point with their index finger, not with their whole hand. And they should be pointing a lot, not just once a month. You also, for the 18-month-old milestones, this is in the social emotional milestone area, we want to have the child cooperate with looking through a couple pages in a book. We want them to help you get their code on, help you not be fighting you for self-care tasks or looking at books. And that's where my background as a behavior analyst now for over 20 years really comes in handy, because a lot of kids with speech delays and early signs of autism also develop problem behaviors if we don't learn the great techniques, positive, child-friendly techniques that I'm going to discuss. Also, in 18-month-old milestones, as I said earlier, they should have at least 3 or more words in addition to mama and dada. That's expressive language. They should also be following one-step directions without gestures. So give it to me without reaching your hand out, get your shoes, begin to touch body parts, those kind of things without a visual model. Imitation is also huge with 18-month-olds. 18-month-olds should imitate, and they should also imitate you doing chores, like getting their own little pretend broom to sweep and playing with toys in a simple way, like pushing a toy car and not just lining things up or playing repetitively. And finally, in the physical movement category of 18-month milestones, they should be walking without holding on to anything. They should be drinking from an open cup with your assistance, trying to use a spoon, and feeding themselves with their fingers. So you notice that only one of the things I just mentioned had anything to do with expressive language or talking. So really, when kids are little, and I say this in my most popular blog, Is It Speech Delay or Autism? I say one of the big things to look for with an 18-month-old is whether they are pointing with their index finger to request things and also to show you things like an airplane in the sky. If they are, that is a good sign. That means that it might be, quote unquote, just a speech delay. Okay, moving on to the third action step you can take. After you find out the milestones and then compare it realistically with what your toddler is doing and saying, then if you have a big discrepancy, I would urge you to learn some of the early signs of possible autism. So there is a thing called an MCHAT, Modified Checklist for Autism in Toddlers, and you can go to the show notes and find a video blog I did on the MCHAT, and your child's pediatrician should be doing the MCHAT. It's recommended by the American Academy of Pediatrics. They should be doing the MCHAT at the 18-month-old well child checkup, as well as the 2-year-old well child checkup. But you can do it for free on your own, either by following the link in my show notes or by searching MCHAT checklist. Also, to find out some of the signs of autism, my newest book, Turn Autism Around, an action guide for parents of young children with early signs of autism, chapter 2 is that includes possible signs of autism. Now, I know many children who had some of these signs, turned out just to be a speech delay, turned out to be early signs of maybe ADHD in some cases, turned out to be giftedness in some cases. So getting back to action step number 1, don't panic. So some of the signs, there are 10 signs in chapter 2 of Turn Autism Around. Lack of pointing, which we already went over, speech and language delays. And so don't just think about talking, think about understanding, following directions, really important. Not responding to name, excessive tantrums, which you won't see many places, but there's that cooperation, joint attention, delayed play and social skills is definitely a possible sign of autism. Repetitive behaviors like lining things up, or even a hyper focus on letters and numbers, which is called hyperlexia, which I also have a video blog and podcast on. Insistence on sameness could be a concern, like wanting to wear the same thing over and over, wanting the same bowl, wanting the same cup, and not just wanting it, insisting on going the same way to the playground. Some of this, though, toddlers get into routines and they like it. So it is a gray area. None of these signs on its own means autism or not autism. Another possible sign is having excessive sensory issues. Also motor delays, failure to walk on time, and toe walking goes under motor delays. And the final possible sign of autism in chapter 2 is failure to imitate, which typically developing kids learn language and all kinds of skills through imitation. So that is important. So the third action step is to learn the possible signs of autism. The fourth thing you can do today, if your 18-month-old or really any child is delayed, is you can do my brand new free digital assessment. It takes 10 minutes. Over 20,000, mostly parents of toddlers, but there's also parents of older children, as well as professionals, have taken this 10-minute assessment. After you get the 10 minutes assessment done, you will get scores in 3 areas: self-care, language and learning, and problem behaviors. And then you can take those scores to learn what to do. And the 5th and final action step you can take today is kind of learning more. Consider calling your child's pediatrician, consider calling early intervention in. I used to say do that automatically, but sometimes if you have a parent who is willing and able to learn, to assess, to implement things, that parent then can make sure you're going to the right people for the right child-friendly practices. So consider calling your child's pediatrician, early intervention. Consider reading Turn Autism Around, an action guide for parents of young children with early signs of autism, or consider joining my online toddler preschooler course, where half the parents who introduce themselves do not have a diagnosis for their child. It's the same child-friendly techniques, step-by-step, laid out. So you can find information about that by going to the show notes at marybarbera.com/238. So just in summary, I've been in the autism world for over 25 years now. First, as a very overwhelmed and confused parent of a speech-delayed son, and then as a professional in the field. And I truly believe that if I had the information that I have now, Lucas's life and my life would be very different if I had this information way back. So my mission is to change the way autism is detected and treated around the world, and help kids, even with just speech delays or sensory processing issues, do better by implementing child-friendly ways for them to increase talking, increase self-care, like eating, sleeping, potty training, and decrease tantrums, all at the same time in a step-by-step way. Thanks so much for listening. I hope today's episodes gave you the next steps and the confidence to start helping your toddler or the toddler you're concerned about make measurable progress. If you want to continue learning the most effective child-friendly strategies for increasing talking, teaching cooperation, reducing tantrums, you can join our online toddler course and community today. You can learn more by attending a free online workshop at marybarbera.com/workshop. You can learn some more strategies and see if the course is a good fit for you, and I think it will be. And if this episode resonated with you, please leave a review and share it with someone who could benefit. Together, we can truly start turning things around for kids as early as possible. So thanks so much, and I'll see you right here next time.